Good morning. I'm Dr. Sean Coomer, Chief Medical Officer at the University of Kansas Health System. This is Open Mics with Dr. Coomer. In the United States, there's an estimated nearly 30 million people with diabetes. That's nearly 9% of the total population. The majority of those have type 2 diabetes, which happens when your body becomes resistant to the insulin that you're making. And over time, it can't make enough insulin to keep your blood sugar in a healthy range. Continuous glucose monitors, or CGM, have become the standard of care for diabetes management, both type 1 and type 2. But now, CGM usage is expanding with over-the-counter devices, not just for diabetes, but for wellness, metabolic health, and early detection. Joining me today to explain this shift in glucose monitoring is endocrinologist Dr. Dan Tilden with the Cray Diabetes Center and physician assistant Charlotte Burns. Charlotte has a great perspective on this as she also lives with type 1 diabetes. We also have Dr. Kristen Gurdinovac, who is also an endocrinologist and the director of the Cray Diabetes Center. Welcome to everybody.
Thanks.
The FDA approved 2 new over-the-counter CGM systems, Lingo and Libre Rio, both built on Abbott's Freestyle Libre technology. Dr. Gurdinovac, glucose data is now becoming more accessible than ever, but how should this data be used?
I think the over-the-counter continuous glucose monitors are a really nice tool for people without diabetes or people who just want to have a better idea of their wellness, to have a sense of what might be going on inside their body. They help us see patterns where diet, exercise, sleep, stress can all have an impact on our blood glucose levels. So like other wearable devices, I think they provide a lot of meaningful biofeedback. For example, if you see your blood sugar go up after a specific food, you may want to change your portion size in the future or pair that food with protein or fiber to see if that can impact a lower spike in the future. And then in the same way, if you notice that your blood sugars are particularly steady on days that you can take a walk after dinner or have a good night of sleep, then that's again incredibly useful information to make healthy lifestyle changes.
So continuous glucose monitors track glucose levels every 5 minutes, offer trend data comparing to a single reading. Charlotte, from a patient and provider standpoint, what does CGM data provide that traditionally finger sticks never could?
Yeah, from a patient standpoint, just knowledge and understanding of what's happening day to day, like Dr. Gurdinovac just mentioned, it helps me do everything throughout the day. It helps me decide if I need to eat something before I go see a patient, if I need to take a little bit of extra insulin, go for a walk after a large meal. It helps me sleep better at night as well, knowing that my blood sugar is not going to go low or that I'm going to get an alarm if I'm trending low, so I can wake up and treat that. And from a provider perspective, it gives me trends of what's happening day to day. There's a lot that happens that we don't see if you're only doing finger sticks.
Okay. And Dr. Tilden, can you explain the difference between Lingo and Libre Rio? Are they designed for different patient populations?
Yes, so while the technology is very similar, the lingo is actually designed for people who are most interested in improving their wellness, but don't have a diagnosis of type 2 diabetes, while the Rio is specifically designed and approved for people with type 2 diabetes. There's actually a third device called the Stelo from a different manufacturer that actually combines both of those indications in one device, in an over-the-counter device, as both of these are.
Okay. And Charlotte, how do you think the over-the-counter CGMs might change patient engagement?
Yeah, I think it can really help out, especially in patients who are not meeting insurance requirements for some of the other continuous glucose monitors. Typically, those patients require some form of insulin injection, potentially also a GLP-1 injection as well. And I feel like that's a big area with our patients who they could use that feedback of data. They could use the trends to use more of lifestyle and dietary modifications to understand what's happening with their blood sugar day to day and just have a better understanding of what's happening to them.
All right. So you mentioned a little bit of this before in your previous answer, but do you think the motivation changes for people when they see in real time different changes over just education alone? Do you see some differences there?
Yeah, absolutely, especially with the food aspect and exercise. A lot of patients say, oh, I eat something that I thought maybe was lower in carbohydrates, lower in sugar, but it ends up having a blood sugar spike an hour later, 2-3 hours later, that they wouldn't see with a finger stick. So just having that understanding of how specific foods react with them, how exercise both can raise or lower blood sugar, can help them tweak their daily lifestyle to really try to keep blood sugar more in a normal range.
Okay, all right. The question a lot of you are asking is, do you need a prescription? And no, you don't. These are over the counter. Dr. Godinavats, who is a good candidate for this?
So for the over-the-counter devices, patients with type 2 diabetes that are not using insulin are good candidates for this, as well as those just interested in overall wellness. It's important to remember that these devices don't have alarms, and so they can't warn you if you're dropping low, and they're not supposed to be for medical decision making, whereas the prescription continuous glucose monitors like Charlotte is on are for those using insulin and can get warned if they're having a low.
And that's warned through their iPhone or one of their devices? Is that usually how it works?
Yeah, the device is usually wearable somewhere on the body, and then there's an app that you can have on a phone, but you don't even have to have a phone. A lot of them come with their own devices that read the glucose information if your phone's not compatible.
Okay, and the over-the-counter devices, they don't have warnings, but they connect to a phone too? You have to
They connect to the phone.
You have to actively watch it and look at it, okay.
Correct.
So Charlotte, with so much information at patient fingertips, what guidance can you give patients so they interpret the data appropriately and don't overreact to glucose variability?
Yeah, so that can definitely be a tough part about seeing those trends. One of the most important things I try to tell my patients is that this is more of a generalization. It's not 100%. The continuous glucose monitors are not reading your true blood sugar from a blood draw like a finger stick would. They're reading the interstitial fluid underneath your skin. So those readings can vary from finger stick blood sugars. They won't be exactly the same as what your finger stick is showing, which can cause a lot of concern with patients. And it's technology as well. Technology is not perfect, unfortunately, so sometimes one might be reading significantly different than a finger stick, and we have to take all those things into consideration when looking at it.
When you put these on, how long do they last?
Depends on which device you're using. Some are 10 days, most are 15 days.
Okay, so as opposed to getting a finger stick every several hours,
Yes.
right? I mean, it's a lot more convenient. So we mentioned early, Charlotte has type 1 diabetes, as well as being a provider taking care of diabetic patients. Diabetes as a whole now affects more than 1 in 10 adults in the United States, with millions more living with prediabetes, and people don't even know it maybe. So often they're unaware of the risks that are associated with that. So we went with Charlotte to see what a day in her life looks like.
I see patients with both type 1 and type 2 diabetes.
It's been years since physician assistant Charlotte Burns first walked into the Cray Diabetes Center at the University of Kansas Health System, and it was much earlier than her first day on the job she was a patient.
I was diagnosed when I was 19 years old. It was my first semester of college.
She says the signs were there before her diagnosis: unexplained weight loss, having to use the restroom constantly, and always being thirsty. But she and her parents didn't know enough about the disease to know the signs.
Nobody in my family ever had any inkling that I would be diagnosed with type 1 diabetes, especially when I was 19. We have no family history of type 1 diabetes.
The diagnosis changed what she chose to study in school, and it changed her daily life.
I constantly am thinking about what my blood sugar is, about every 5 minutes throughout the day. Throughout the night last night, my blood sugar was running low, so my glucose monitor was alerting me and my parents and keeping both myself and my parents awake most of the night.
If left untreated, high blood sugar can have a myriad of devastating consequences, including heart damage. The National Institutes of Health says over time, high blood sugar can damage the blood vessels and nerves controlling your heart. The CDC says if you have diabetes, you're also more likely to have other conditions raising your risk for heart disease, like high blood pressure, high cholesterol, and high triglycerides. And the American Diabetes Association says adults with diabetes are twice as likely to have a heart attack or a stroke compared to people without diabetes. Charlotte says the age at which people develop type 1 diabetes is getting older.
I personally have friends and patients who have been diagnosed with type 1 diabetes in their 40s, 50s, 60s, and 70s.
And there are many theories as to why.
So my kind of leading thought is that there must be something environmental that is triggering something within our genetic code to flip the switch to turn your immune system on to attacking your beta cells in your pancreas.
No matter the cause, her message to her patients is what her doctor first told her when she was diagnosed at age 19.
She said, "Are you going to control your diabetes, or will you let diabetes control your life?" I think it's better to think that you can control your diabetes rather than letting it control your life for you.
Charlotte, thanks for doing that. Really appreciate it. That's really helpful. You make a point to show your diabetes devices like an insulin pump and a CGM. How do you think seeing more people wearing devices like this changes perception for people hesitant to be attached to something?
Yeah, I definitely think it can destigmatize diabetes as a whole, as well as it opens it up for conversation for more people with and without diabetes. I see people all the time now that have continuous glucose monitors or pumps on their bodies, and it always makes me really excited. And nowadays I say, hey, are they diabetic? Do they have type 1? Do they type 2 pre-diabetes? Are they just using these for just general wellness checkups and monitoring? So I think just being able to see it in public makes it more visible, makes people more aware as well.
Dr. Tilden, we're seeing rising rates of insulin resistance and type 2 diabetes at younger ages. Could more access to CGM help identify the risk earlier, or maybe even before beta cell damage? Beta cell is what makes insulin in our bodies within the pancreas.
Absolutely. Yeah, I definitely think it is one of the tools in our toolbox to help folks identify when they're at risk for diabetes and when they're actually developing diabetes. Having the information, the data coming in from a continuous glucose monitor, especially when folks have access to wearing them before they actually develop the diagnosis of diabetes, can be a really helpful tool for us to identify those who are at higher risk and might need additional treatment or closer monitoring of their blood sugars as time goes on. And as Dr. Grdinovac sort of highlighted, I think it's a really useful tool for those who are at risk to help them to identify trends in eating and trends in exercise and sleep that might be impacting those blood sugar levels to help get around some of the abnormal and negative effects of high blood sugars.
So Dr. Grdinovac, can CGMs meaningfully change behavior like diet, exercise, or sleep, or do you see diminishing returns after the initial novelty wears off?
We know that CGMs can absolutely drive meaningful changes. The studies have shown us that CGM use can decrease hemoglobin A1C, increase your time in range, but it can even alter your lifestyle changes for long-term benefits. It's only when those patterns become more consistent and less predictable, or more predictable, that the novelty might wear off. And so for patients that are using them for general wellness, they may just use them periodically as a check-in without those targets and goals and active engagement with the device. It can lose its novelty over time.
So you think some people actually use these CGMs and then get themselves in better habits maybe with diet and exercise, and then don't pay attention and they might be in a better place?
Yeah, I mean, the CGM helps you learn your body. I'll know that this specific food probably spikes my blood sugar, and then that leads me to make meaningful changes of only having that food periodically. And then when I can see that my blood glucose trends are at goal most of the time, I know that the habits that I'm engaging in during that time are something that I should be able to maintain moving forward and have good glycemic control.
Great, thanks. Charlotte, the Lingo CGM is for people focused on wellness who want to understand how food, sleep, exercise, and stress might impact glucose levels. What do you say to critics who worry that this is medicalizing wellness?
Yeah, this is definitely a big topic nowadays, especially in the CGM world. I think part of it is if we can get this technology option to more people that can use it meaningfully, that can help improve access for the patients who are needing it for their blood sugar specifically. So patients who are not on insulin or certain other diabetes medications, it just helps with access in general. And also a little bit more information for patients who may not have diabetes but are at high risk for it, that can help them stave off and prevent blood sugar from worsening over time without us having any knowledge of it.
Yeah, it's interesting, medicalizing wellness. Well, wellness is good medicine is wellness, right, I guess. Charlotte talked about her theory of why we have more type 1 diabetes. What is your theory on that?
I think she's pretty spot on. Type 1 diabetes is an autoimmune condition, and so we don't know the ins and outs of it, but we do know that there are things that trigger that autoimmune response down the road, whether it be a virus, a severe illness, things that we don't know about yet. And we do know that one autoimmune disease can put you at risk for an additional one and put you at risk for an additional one. And so we do see some autoimmune diseases running together.
So we are here to answer your questions. Please send them in using the links on your screen, YouTube, Facebook, or email the Medical News Network. We know many of you have questions, so let's head to Studio B with Alexis.
We have a lot of great questions that are coming in. Jeremy Yenser wants to know, for the doctors and for Charlotte, is it purely sugary foods or carbs that affect your blood sugar, or do other things like stress or sleep affect it?
Who wants to take that one?
I can take it.
All right, go for it, Charlotte.
So yeah, I tell people pretty much anything can affect your blood sugar, unfortunately. Stress is a big one. I know I see that in myself, especially at work some days. Food, absolutely. I like to remind patients that proteins can also raise blood sugar to some degree. It's not just those carbohydrates and those sugars as well. And exercise can affect blood sugar too.
Marie has a question. And actually, I've wondered this too. We keep hearing about the dangers of ultra-processed foods. 60 Minutes did this huge report on it. Do ultra-processed foods also create problems with your blood sugar? Can that affect diabetes?
I can take that one. So ultra-processed foods tend to have more refined sugars, and because they have more refined sugars, those sort of hit your body more quickly and tend to spike blood sugars higher more quickly and are more difficult to control, both for people who have diabetes and use insulin, for example, or people even who do not have diabetes. And so when we see ultra-processed foods, what we're seeing really is those refined sugars, as well as they tend to be less nutrient dense and have fewer other nutrients like proteins and fat that also exacerbate those spikes in sugars. And so we do see the change in blood sugars become more rapid when folks are eating a lot of those ultra-processed foods.
Becca has a question about continuous glucose monitors. She wants to know where she can get one. Can she go into a pharmacy and request one?
Want to take that one?
I think so. I haven't ordered one yet.
So I actually did some homework on this and looked it up. So you can get them on online pharmacies like from Amazon. Some of the Libre products are available in store at Walgreens and CVS, but you tend to be able to get them from the mail order sources a little bit more easily.
Jacob wants to know, what's the normal range for glucose levels if you don't have diabetes?
I can take this one. We look at glucose ranges both fasting and with meals. And so typically the normal range for someone without diabetes is fasting 80 to 100. And then we do anticipate blood sugar to go up with food. That's normal. And we would like it to be less than 150 about 2 hours after you eat. That would be considered normal range.
We've got several more questions, but I also know Dr. Hawkinson is in the studio, and he has some updates for us this morning for some other trending health news.
Yeah, we'll go to Doc Hawk. He's running a little tardy this morning, so we'll punish him a little bit. So, Doc Hawk,
hey,
you're up.
Yeah.
Let's talk about the flu, okay?
Yes.
Where are we right now as far as numbers and hospitalizations?
Yeah, I'll just say I was just seeing some patients in the hospital, but only one of them actually had influenza. It was actually influenza B. So what we have seen is that as of February 13th, the FluView report did come out. Overall, there is still continued uptrend in influenza activity. There was a slight decrease. There you can see on that graph, there is the orange line. That was last respiratory season, 2024-2025. That is, this graph shows the number of people or percentage of people going to the emergency department or a medical evaluation for influenza-like illness. So the orange was last season. You can see there were two spikes, two peaks. The red line is where we are currently. You can see that earlier in late December, early January, there was a very high peak of people seeking care for influenza-like illness. It did drop. It still remains high. And what we say by high is that dotted horizontal line is basically the epidemic level. So most of the year it is below that line, but certainly it continues to be well above it. So we do know that there is continued influenza activity as well. And we also do have our numbers at the hospital, but just going back to the nationally, we know that in general, influenza A was the largest contributor to influenza isolates. It is still the largest contributor, but we are continuing now to see an increase in the levels of B as well. So here at the hospital, what we can see is the numbers of influenza, RSV, and COVID admissions. And this is over the past few weeks. You can see that last week in December and first week in January, we had the highest number of influenza admissions, which is in that blue bar on the graph. The green is COVID and orange is RSV. So still maintaining a little bit more influenza, RSV, and COVID than we would like, but certainly as far as influenza activity, it is much improved.
Dana, on the previous slide, it kind of showed a double spike last year. Mm-hmm. Are we going to get a double spike, or we just don't know? Any predictions?
You know, I predict we will. Many seasons we do, and that does tend to be a little bit lower, but that's also when we have influenza B now coming through and affecting the community more than influenza A. So hopefully not, but as you can see, Sean, just as you pointed out, the activity remains high. It's certainly reasonable that there can be an increase of activity. And like I said, what we are seeing now is that the public health laboratories are reporting more influenza B isolates. We may have that. We may see that.
Yeah. My son's college lacrosse team has influenza B ripping through it right now.
Well, there you go. So that's
but that's in New York. So
yeah.
So let's switch gears and talk about measles. We're seeing some more cases this year. What's going on with that?
Yeah, overall, we know that cases are high. So per the CDC data from February 13th is the last updated time. We can see from, we should have a graph or a infographic showing that already in 2026, we have 910 cases. You can see there were over 2,200 in 2025. But we have to point out that the vast majority of these patients that did have measles were unvaccinated or incompletely vaccinated as well. So again, we need to show, and we've showed this about different vaccines, whether it's influenza or measles, the vaccine does not protect against infection. That's not the purpose of vaccines. The vaccine protects against the severe consequences and severe cases and the complications of the disease if you are exposed or are infected with that. So the vast majority of patients that have been diagnosed with measles are unvaccinated or incompletely vaccinated or unknown vaccine status.
Yeah, in 2000, it had been eradicated, right? I mean, that's pretty unbelievable. Now it's come back because I'm unvaccinated mostly.
Yep.
But yeah, I think it's a really good point is that vaccination does not mean cure or never getting it. It just minimizes that and gives herd protection, right?
Absolutely, and I think that's a great point. Herd immunity, herd protection, population immunity, that is what we want from vaccination, from high levels of vaccine coverage. That is typically over 95%. Why is that? Because then if somebody in the population gets it, everybody else around them is protected and vaccinated and can stop that route or that chain of transmission. That is not what we're seeing here now in a number of different places, especially if we want to talk about South Carolina. We know that is the largest one right now. So 17 new cases last week. Yesterday, the newest data shows that actually 962 cases so far in South Carolina since October of 2025. And also, it is not a benign disease. So a couple weeks ago, the South Carolina, one of the state health officials did come out and say that a number of patients were hospitalized because of the brain effects or brain infection by measles as well. So what we call encephalitis. Sorry. But I would point out that, again, it's not a benign disease. We know that people can go to the hospital. They can get pneumonia. They can get, obviously, the brain disease. So we just have to understand that vaccination helps protect against those as well.
Still time to get your vaccine, flu, COVID, and you always can get your measles.
Yeah, absolutely. You know, again, you talked about that second spike coming through. Although it is late in the season for influenza, it is still reasonable to get that. You can help build up immunity. Even if you've had influenza already, you can still get infected by other strains. We know that influenza protects against severe consequences. Also, an article a couple weeks ago came out and saying influenza vaccine actually helps protect against cardiac problems such as myocardial infarction or heart attack as well when people are infected with influenza but have been vaccinated. So there is that other protection as well. There is still time to get influenza vaccine, certainly updated COVID vaccine, and of course, if you or someone you know is not vaccinated or incompletely vaccinated for measles, please go get up to date with that measles vaccine.
Thanks. This has been a great discussion. I'm really grateful to all of our guests for being here. But I want to get some final thoughts before we go. Charlotte?
Yeah, I think final thoughts for continuous glucose monitors. It's definitely a really large upcoming topic, especially in the diabetes, health, and wellness worlds. So it'll be really interesting to see how people are able to use these technologies to benefit their daily lives.
All right. Dr. Tilden?
Yeah, I think the exciting part about CGM is the increase in awareness, and it provides people with that impetus to make change, which is really the hardest part. And one of the most difficult parts of my job is asking people to change the way they do things like eat and exercise. Those remain the most important things for people to do. But if this technology can help us to provide that impetus for people to make that change, I think it's a really powerful technology for us to use in the clinic.
Dr. Godinowicz?
Yeah, I echo all of that. CGMs are a great biofeedback tool, and people can use it to really see what's going on, kind of like a window inside of their body, and make those meaningful changes.
Right. Well, let's get back to Alexis to hear what she's working on for tomorrow's show.
Before we get to that, we have one more question that just came in from viewer Claudia. Can I ask that real quick of Dr. Godinowicz? She wants to know, does sleep apnea cause type 2 diabetes?
Sleep apnea does not cause type 2 diabetes, but this can all be in the realm of insulin resistance and metabolic syndrome. And we actually do see on continuous glucose monitors overnight blood sugars tending to rise if somebody has uncontrolled sleep apnea.
Interesting. That would go back to what we talked about, how sleep could affect blood sugar. This has been a great discussion, and coming up tomorrow on All Things Heart, Ryan Azuth has a great outlook on life, a life that's not without its own challenges. We will share his journey living with Duchenne muscular dystrophy, explain what that is, and his involvement in a first-of-its-kind trial involving his heart. That's tomorrow at 8 a.m. You're going to want to meet this family. He and his mom are pretty amazing, Dr. Coomer.
Yeah, it sounds like a great show.
Yeah.
Thanks, Alexis. And thanks again to all of our guests and to our audience. Remember, faith, hope, and science.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.